Today's topic is safe sleeping in pregnancy. What does that mean? Hi, my name's Eliza. I'm a registered midwife and I work with the beautiful team here at Haakaa. I'm also the creator of Bump and Bub, my beautiful online community. We refer to safe sleeping being once you hit that 28-week gestation mark, so going into that third trimester, it's really important not to sleep on your back. And there's a few reasons why we say this, and we're going to dive into them now. There's several studies that suggest when mum goes to sleep, so going into the supine position, laying on her back after that 28-week gestation mark, there is pressure, understandably, from not just baby, but the fluid around baby, the placenta, everything that comes with being pregnant. So there's a fair bit of pressure on mum's aorta and inferior vena cava. What that means is that there is then a reduced blood flow going to baby. And we know this by some great research that's looked at MRI, so the blood flow exactly going through baby and through the placenta and back to mum. And we know that during this compression, when mum is sleeping on her back, it can reduce the blood flow by 80%, which, as you can imagine, is a substantial and very significant amount of blood flow that is reduced. We also know that when we sleep on our back, due to the quite significant blood flow reduction, we increase the risk of stillbirth by 2.5 to 8 times the risk of a mum who goes to sleep not on her back. So it's very significant, and it's a really important topic that we do talk about. Something really important to note, and again backed by evidence, is that when we go to sleep, the position that we go to sleep in, meaning when we get comfortable finally and fall asleep when we're pregnant, that's the position that we'll stay in for most of the night. So in saying that, it can be really worrying that you may wake up on your back, and we'll get to that a little bit later, but the most important thing is making sure you're going to bed on your side, so either the left or right side. The evidence shows that both is equally fine. Going to bed on your left or right side and avoiding the back position. So as I said, what happens if you do, wake up and you are on your back? There's nothing that you can do. You can't control necessarily how you sleep. Simply hop up, roll over to one side. If you can, kind of prop yourself up and position yourself with some pillows. There's some great maternity pillows on the market that can help you not to roll on your back, just to help you get you comfortable. But the other important thing to know, and I definitely experienced it firsthand, was if you do wake up on your back, often you feel you're kind of woken up from a deep slumber due to feeling nauseous and maybe lightheaded and a bit sick, because as we said, there's that really big reduction in blood flow, and mum often is woken up feeling a bit yucky. So the body is clever in that way. So again, if you wake up on your back, simply roll over to your side. Obviously, if you have any concerns, it's always very important to seek advice and seek care as soon as possible if you are concerned for any reason. But overall, going to sleep on your side and waking up, if you do wake up in the night on your back, just simply rolling over are some of the most crucial things that you can do from that 28-week gestation mark to help reduce the risk of a stillbirth in your pregnancy.